can close this session. Thanks to all the speakers for giving excellent talks and having an interactive discussion. So it's over to Dr. Naresh for and his team to continue.
Do we have the Dr. T.P. Sahu with us to make the final concluding remarks of the day one of this meeting? Dr. Sahu. So if Dr. T.P. is not here, I think Dr. Shyam Agarwal has done a nice concluding in the discussion. Otherwise, in a lighter vein, in the last, I would like to say, as far as these gastric guidelines are concerned, I will be treating the patient first line with the Folfox plus minus IO. Then Dr. Shyam will be treating the patient with the Cyramza with the Taxan. And finally, the Vinith will be treating the patient with the Pembrolizumab. This is how the patient journey moves from Jaipur to Delhi, or from the 2-tier city to the 3-tier city, or from a treating center to the referral center. So with this,
so Naresh Samani sir, I would like to request to select the best question of the day.
So I have requested, Dr. Shyam has not gone into that.
Yeah.
Dr. Shyam has seen that or not? So there were the 3 questions in my mind which I could click. So I would request Dr. Shyam sir to make the choice out there. Let me present these questions to Dr. Shyam sir. One question is from Dr. Anu Rajpurohit. If the HAR is a dynamic, so repeat biopsy is advised prior to the TDXT or dextricam therapy. That is the one question she is asking. And 2 questions are from the delegates, from the Dr. Mukandar Sheikh. Is this possible that the patient ERPR negative and HAR2 positive? So I don't know in what context he has asked this question. And one is from Dr. Lepakshi. Is the HAR new testing in fresh sample change in the concurrence rate? So there's another question. I don't know in what context CSR. So Dr. Shyam Agarwal, sir, what do you think that which question?
Can you repeat the first question from Dr. Anu Rajpurohit? I think that seems pretty okay. Yeah.
So that's the prize winning from the 2 days. And who will be actually answering this? Should we repeat the biopsy to make it like 0 or 1 or 2?
So regarding the repeat biopsy in breast cancers, I mean, what they are saying is that when patient develops metastatic disease, so, one biopsy is always in order or sort of mandatory in the course of illness to look at the evolution of the ERPR and HER2 new status. But let me also add this, as the practice is evolving in the Western countries, a lot of liquid biopsies are being performed on a sequential basis. Once the patients, they stop responding to one treatment, then they have to go on to the next. So I think we are still not there in our country because the liquid biopsies, I think the expertise is developing. I've been having discussions with labs like MedGenome who are really doing very deep sequencing, because for liquid biopsy, in order to be validated, you really have to go 5,000x, 10,000x. So I think repeat biopsies, especially liquid biopsies, are going to be in practice as we have more and more targeted drugs also available in the future. So I think liquid biopsies and repeat biopsies are futuristic, and actually at the moment in our country being practiced, like in lung cancer and even in breast cancer.
Thank you, sir. So this prize goes to Dr. Anu Rajpurohit, and the other prize of remaining maximum time, I think that will be, we will be announcing it tomorrow based on the how they screen the data and they do it. I think the back team will be doing it. And with this, I thank all of you, and I hope that tomorrow you again will be joining. And once again, happy festive season and coming Deepavali to all of you. Good night.
Yeah. So happy Navratri.
Happy Navratri. Good night. Good night, everyone. Thank you for joining. It was a brilliant discussion. Thank you, everyone.